Hey, so it's day 5 of rhinoplasty recovery. As you can see today, I washed my hair. Feel fresh and clean. Only thing was, it was quite a difficult process. I think my advice for future patients, because they recommend day 5 you should wash your hair only, and I tried to do it on my own. I wasn't very successful. I think the only reason is because if you have quite long hair like I do and quite heavy, I had to tip my head back and then put the shower on top. Obviously, like scrubbing your hair like this was moving my entire face, and it also felt really heavy when I was showering it and then leaning my head back, so it was quite heavy pulling my head back, and then obviously it would pull my nose a little. A strange feeling, but it was starting to pull my nose a little bit. I think I would have been better with a bit of help, maybe from, if you have family there, to just sit on a chair and maybe lean your head against a sink instead, because I did it in a bath and I had to stop halfway. I just scrubbed it a little bit on both sides and then just washed it out because it was just too much for me. I think it was a little bit early for me to wash my hair. Maybe try again in the next couple of days, might be a bit more successful. But you do feel a lot more fresh. Still absolutely no bruising. I'm on my last days of my antibiotics and my other medication too, but I'm going to continue taking the vitamin C tablets, which helps the healing, and continue taking, I think it's the arnica for the bruising and swelling. I think that's helped me, so just to maintain that. I don't think there's going to be any more bruising anymore after day 5, but carry on taking those. Again, not much change really, just what I did want to speak about is if I was to change anything in terms of my recovery. I would advise all patients to get the diazepam. Dr. De Silva does a very clear prescription before the surgery as to what medications should be taken and can be taken on your own choice. I actually crossed out the diazepam when I went to the pharmacy, it's just a tablet to help you calm down and help you sleep, I think. I'm not really used to taking tablets and stuff, so I crossed that out, and I didn't really think about my recovery too much. I just thought I don't want to take any medication. But I think for the first day, the second day and the third day, you are going to have sleepless nights, and because of the leaking the first day and like a bit of discomfort, I think diazepam would have really helped me, and it could help like future patients as well. And having a good night rest is a massive factor in the healing process. It helps you heal and it helps you rest and relax, so I think for future patients it's best to have the diazepam if you can't sleep, especially for the first night. Not much change apart from my stitches. Last night I woke up only once and I had a good 10 hours sleep, which is good. The stitches are starting to itch a little bit. I think that's quite normal because itching is a sign of healing, and I also feel like my nose is like dripping, or like bubbling or something inside, and I really feel like blowing it, but there's nothing there. I think it's just a bit of dried blood, but as you can see, I've taken most of the blood out from my nose. There's absolutely nothing there right now. Just a little bit on the side here which I can't seem to get off, but quite itchy down here. Still applying the antibiotic cream on the stitches, but the stitches are quite tight and in place, and no problems at all with that. Absolutely no leakage, and yeah, that's about it. Apart from the hair wash, nothing else today. Been eating okay. I didn't actually go out the house today. stayed in and just took a bit of rest. I did try cooking today, but I think my advice on that would be to just take that slowly as well, because picking up pots and pans and trying to drain rice and stuff like that, I know it seems like a minor process, but once you've had surgery you realise how much strain it actually puts on your body. So yeah, just to be careful on that. Just show you from the side again, just looking better, I think. I can see a change again today, less swelling. I feel like it's getting like smaller every day, and it's just right for me. It's exactly how I wanted it. I'm just like really desperate now to get my cast off and take the stitches out and see what it looks like. It's really frustrating because I just want to pick it up and lift it off and see my new nose, but it's all about patience. So yeah, can't wait to see Dr. De Silva again. I should be seeing him on Friday, hopefully. That would be the 9th day. I think normally they say sutures can stay in up to about 2 weeks, but I think Dr. De Silva likes to take it out within 7 to 9 days, so that there's less scarring. I don't think I will have any scarring anyway, because I don't have anything at the minute either, and if I did, then just to cover it with a bit of makeup, but I'll update you all on that on Friday. And yeah, nothing else to say really. I'll post a video again tomorrow, which will be day 6. Thanks guys, bye.